Hello, my name is Zainaba Ali, and this is on the PAARP model for healthcare leadership. Today, I will be presenting a leadership strategy to address the critical issue of staffing shortages at the Trustingham Home Care. We'll use the PAARP strategic leadership model that's designed to improve team effectiveness and guide in healthcare organizational changes. Why this leadership model? Addressing staffing shortages, burnout, and healthcare disparities and crises. When applied throughout a team's life cycle, the purpose, assemble, and charter align, resource, perform, or known as PAARP model can lead to better teamwork, better results, and more value for the organization. Today's healthcare delivery is too complicated for leaderships. The interdisciplinary cooperation is vital for quality improvement, public health initiatives, and patient care management. In these complicated contexts, the PAARP model offers a methodical, stepwise approach to creating teams that produce tangible outcomes. What is the PAARP model? The acronym stands for Purpose, Assemble, and Character Align, Resource, Perform. It's also known as the interprofessional team model, which shows the development and admission of successful teams, especially in interprofessional settings. The way we use PAARP is as follows. Clearly states why increasing staffing is necessary to support patient care. It brings together all relevant parties, such as caregivers, leadership, and HR. Goals should be in line with worker demands and high-quality results. It could be used to obtain revenue and technologies that are required. Lastly, routinely assess workers' stability and team effectiveness. Overview of the PAARP model. This model outlines 5 phases that the interprofessional teams go through: purpose, assemble, and charter, align, resource, and perform. The model emphasizes the leader's role in guiding the team through these phases, especially during transitions. Phase 1, Purpose. The initial phase focuses on defining the team's overall goal and objectives. What is the team trying to achieve? What problems are they solving? This stage involves clearly articulating the team's mission and vision. Every effective team begins with a clearly defined purpose. In healthcare, this may be improving patient outcomes, redesigning workflow, or responding to a public health emergency. Without a unifying purpose, collaboration doesn't withstand. Leaders must ensure everyone understands and buys into the why. According to PAARP, it is the actions of the leadership that gives purpose to a group, as stated in Myron 2023. Phase 2, Assemble and Charter. The team must then be assembled and chartered by the leaders. This involves choosing team members with the appropriate level of experience and then outlining expectations, decision-making power, and operational guidelines. Chartering establishes the team's framework and fosters a collaborative environment. The team's structure, duties, and responsibilities are all established during this phase, along with the selection of team members who possess those skills and expertise that are needed. Creating a charter that outlines the team goals and values and protocols. In addition to selected team members who can perform the desired group activities, it is essential that the proposed group members have good interpersonal skills and can all work together, as stated by Myron 2023. Phase 3, Align. During the alignment phase, teams make sure that the department goals, organizational missions, and individual goals are all in line. The team structure, duties, and responsibilities are established at this phase, along with the selection of team members who possess the necessary abilities and knowledge. Creating a charter that describes team goals, parameters, and protocols is another aspect of it. Leaders encourage decision and about common expectations and values. Additionally, this is the moment to resolve any team conflict and establish the rules that can prevent people from the proper cooperation. The competing needs of the group members as defined by Schultz, which are present in the assemble phase, continue through the align phase as a group member finds their place within the team. Phase 4, Resource. This phase involves providing the team with the necessary resources to succeed, including funding, equipment, information, and support from stakeholders. Teams need more than good intentions. They need resources. That includes access to tools, data, and times to meet. Leaders must advocate for these resources and eliminate barriers that may come in place. Under-resourced teams are destined to fail, even if they have the right people behind them. Therefore, adequate resources are crucial for effective team performances. In resourcing, the interprofessional team sets goals and expectations both for individual members and the team, stated by Myron, 2023. Phase 5, Perform. In this final stage, Perform, the team puts its plan into action. This is the phase where the team actively works on achieving its objectives. It involves implementing strategies, making decisions, and delivering results. Effective performance requires strong leadership, collaboration, and ongoing monitoring of progress. That might be something like executing responsibilities, tracking performance, and adjusting as needed. Effective leaders provide feedback loops, recognize success, and promote a culture of excellence and learning. Identifying the issue. Staffing shortages are a persistent challenge at Trusting Hand Home Care, affecting care quality, employee morale, and organizational efficiency. According to Haddad et al. 2020, staffing shortages have a direct impact on patient safety and staff burnout. Addressing this issue requires a strategic leadership approach that aligns purpose, people, and resources effectively. Strategies for model adoption. To ensure the PAARP model adoption, the first thing one can do is educate leadership through workshops. The second thing would be to integrate the model into onboarding and management training. Thirdly, they could launch a pilot project within one department to test and refine as needed. Fourthly, collect feedback and reiterate. Adoption requires consistent communication and role modeling from leaders. The key stakeholders for adoption. So the first key stakeholder will be the owner, which is Jamila Kareem. Key stakeholders include the owner, care coordinators, HR nurses, supervisors, schedulers, and caregivers. Each plays a role in hiring, onboarding, scheduling, and daily service delivery. Their engagement is crucial to aligning operations with the PAARP model and ensuring collaborative implementation, as stated by Marcus and Houston, 2021. Stakeholder buy-in strategies. So for the first strategy, one should conduct collaborative planning sessions to co-create goals. This could be involving them in early planning. Secondly, you would provide transparency with data to show the need for change, using the data to show how staffing gaps affect these outcomes. Thirdly, you would offer incentives for departments that meet the PAARP performance milestone. Fourthly, you would recognize and highlight early success stories in the newsletters and meetings. And engaged stakeholders are more likely to commit to the model and drive change, as stated by Safanto et al. 2017. Stakeholders engagement. The PAARP model isn't limited to internal teams. It also enhances collaboration with external stakeholders, patients, public health agencies, community organizations, and insurers. Everyone is aligned around the purpose, resources, and performances. Active patient involvement and stakeholder engagement in health research becomes essential to better information and diagnostic management and communication in a framework of every expanding resource defined by the rise of artificial intelligence and other technology, stated by Pellegrini and Loveda, 2025. Evaluation plan. We'll evaluate the model using the Kirkpatrick's 4-level evaluation model. So for the first model will be reaction, the staff perception of the PAARP training usefulness. Second one will be learning, the assessment of PAARP principles among team leaders. The third would be the behavior application of the PAARP in staffing decisions. And then the fourth would be the results, which the changes in retention, satisfaction, and client outcomes. The data-driven evaluations provide insight into both the effectiveness and areas that need improvement, as stated by Kirkpatrick, 2016. Expected organizational impacts. The PAARP model is expected to improve internal communication, increase caregiver engagement, reduce burnout, and enhance the quality of care. It promotes alignment between leadership and frontline staff and supports accountability, as stated by Marcus and Houston, 2021. Operational efficiency and performance outcomes should also improve as the staffing stabilizes. Quality, performance, and finances. The PAARP model offers a practical, team-centered approach to resolving staffing shortages at Trusting Hand Home Care. To start off, the quality would be to better staff client matching that would improve the satisfaction of them. As far as the performance, it would reduce the time to fill those staffing gaps. For financing, it would cause savings and lower turnover and the training redundancy. As far as the change management, the PAARP model would drive structure and phase the implementation. By following its 5 structured phases, we can better align the organization's missions with the workforce needs and ensure high-quality, compassionate care for clients. Real-world application in healthcare. Bloom's taxonomy of the cognitive domain outlines a hierarchy of intellectual skills ranging from basic recall to complex creative thinking. The revised version was published in 2001, and it was categorized these skills into 6 levels: remembering, understanding, applying, analyzing, evaluating, and creating. These levels are often visualized as a pyramid, with remembering at the base and creating at the top, representing increasing levels of cognitive complexity. Implementing PAARP as a healthcare manager. As a future healthcare manager, I will use the PAARP model to lead high-functioning teams. Whether working on quality improvement or strategic initiatives, I'll ensure we define purpose, build a well-chartered team, align goals, secure resources, and continuously improve performance. In conclusion, the PAARP model provides healthcare leaders with a powerful structured framework for building and managing interprofessional teams. By focusing on purpose, structure, alignment, and resources, PAARP ensures that teams are not only well-formed but also equipped to succeed. Whether they're launching a new program or leading a department, this model helps create the clarity, accountability, and collaboration needed in today's complex healthcare environment.